cancer diagnosis, there are important services to help build a fulfilling life after treatment, one of which is fertility preservation. Chemotherapy and radiation can affect both female and male patients depending on their age and treatment exposure. So Seattle Cancer Care Alliance experts work with patients to protect their fertility before treatment even starts. Simone Alin is a former patient at SCCA who underwent fertility preservation after being diagnosed with early-stage breast cancer. How are you?
Doing good.
Good to have you here, and your health is good at this point.
Yes.
Doing well. Tell us a little bit about what life was like when this diagnosis was given.
Well, I was in my mid-30s, and I had known my husband for just a couple years at that point, so we were just starting to talk about whether we'd want to have kids and trying to figure out where we would fit them into very busy lives. We're both scientists, and so, you know, we were traveling all the time at that point, and so I was just about to head to Brazil for field work when I felt a suspicious lump and went to the doctor. So,
and a diagnosis is given, and suddenly,
yes,
instead of those questions that seem so easy, like when will I have kids,
yes,
it's will I have kids?
Right.
What was that like emotionally to deal with?
Well, I don't know, emotionally, my mother had breast cancer in her mid-30s as well, so I had always kind of feared getting breast cancer, and in some sort of odd way, it was almost energizing to have the diagnosis and have something concrete to deal with. And so, you know, I did what I do. I researched all the stuff I could find about it.
It's good to be a scientist.
Yeah, right.
It's good to be a scientist. So how did you learn about Seattle Care Alliance, and how did you sort of work through the fertility issues?
Well, so I was referred by my doctor at University of Washington, where I was a postdoc at the time, to the SCCA for a mammogram, which did not find the lump that I had felt, and an ultrasound, which did see something suspicious that they biopsied there. And so it was only after I met with a team of specialists there that we really started to, I have to say, fertility was not on my mind that week, really, particularly. Right. So
at that point, you're just trying to figure out how you're going to deal with this, survive, and move on. Right. So at what point in the treatment did fertility become a topic?
Well, one of the things that they do at the SCCA that's so brilliant is when you, after you have the diagnosis, you go in and meet with a panel of people. So I actually met with the surgeon, the person who did my chemo, and the radiation specialist all on the same day. They talked me through treatment options and gave me sort of the points where I could make decisions about which treatments to go with and so forth. And then the chemo doctor, Dr. Livingston, asked me, so where are you in the process of having children? Are you all done? And we said, I don't know.
We haven't actually started.
We don't want to rule that out, but we haven't given it a lot of thought lately. And he said, okay, so well, we can give you some fertility treatment options, and we started discussing those at that point.
How wonderful to have that discussion before you even begin treatment, so that every possible opportunity is left open. Right. So what did you end up choosing to do?
So they ended up giving me monthly injections into my belly, which put me into a temporary menopause, so that I guess my ovaries weren't quite as bathed in the chemotherapy as they otherwise would be. And so that was kind of an interesting experience to go through on its own. But then, you know, a few months after chemotherapy ended, I came out of that temporary menopause, and things were kind of back to normal.
Back to normal, and what happened?
So I had follow-up treatments for a few years, so we didn't really revisit the kid issue for a while, and by then I was in my late 30s, early 40s, and so, you know, more than deciding actively that we wanted to have kids, we were, because, you know, we thought we might be disappointed in that, and still were quite busy with our careers, and had a lot of travel on our plates. We just decided not to try not to have kids.
That's one way to make the decision.
Yes, exactly. And so I was actually supposed to go on a cruise, a research cruise, not like shuffleboard and cocktails by the pool, but a lot of hard work on, you know, 24-hour shifts and so forth. The following Monday, when I realized I was feeling kind of nauseous, and that wasn't really normal for me, and so I took a pregnancy test just to rule it out. And then when it was positive, hustled into the doctor and learned that, yes, I was pregnant. And 2 days later, learned that it was, in fact, twins through an ultrasound.
Let's take a look at a picture of those twins. There they are. We are so happy for you. That's amazing. How
Yeah.
old are they now?
Now they're 6.
They're
and
6 years old.
They're my daily challenge and inspiration.
Yeah, it's a little bit about how amazing. So
Yeah.
this whole experience and the way that SCCA approached this has made such a difference in your life.
Absolutely, and I have to say that going through cancer treatment there is pretty amazing because, you know, nobody thinks of cancer as a stress-free experience. And I will say I was very fortunate to have an early stage diagnosis so that it was much easier to treat than I think many people deal with. But, you know, I didn't have to think about scheduling or dealing with a lot of bills coming from different people. It just made it so easy. And so, yeah, the whole experience was transformative.
And now there are 2 little people in the world.
Yes.
2 little
Yes.
people in the world.
Yeah.
Thank
amazing.
you so much for sharing. I'm so glad. I'm
Thank
glad
you
you're
for
well. I'm
having
glad
me.
you're a mom, and I'm glad the
too.
twins have 2 such super smart parents. Coming up next, clinical trials can lead to groundbreaking treatments, what patients should know, and how you can participate right after this.